We're going to be starting about midway through the digestive system notes, chapter 23, at which digestive processes occur in the small intestine. These are the ones that you need to know. So we don't ingest through here, we don't eliminate through here, but we do everything else in the small intestine. Principally, these middle two are the big ones that are happening here. So this is the first time that we have enzymes that digest every major category of nutrients: carbs, proteins, lipids, and nucleic acids. Also, this is going to be the first time that we've actually gotten the food down into small enough molecules that we can absorb most of it. While we have done a little bit of absorption in some of the earlier places, almost all of it happens here in the small intestine. Next up. The ileocecal valve is the door between the small intestine and the large intestine. Specifically, it's between the ileum of the small intestine, which is why it's called the ileocecal valve. And remember, the bottom part of the large intestine is the cecum, and so ileocecal sphincter is that little sphincter muscle right there between those two things. The small intestine has three parts to it: the duodenum, the jejunum, and the ileum. I kind of already talked about the rest of those parts earlier, so I'm just going to kind of skip right past that. The anatomy of the small intestine is highly modified to help make sure that it can do everything it needs to do, which again is principally going to be chemical digestion and then absorption. So what we're going to do is we're going to have folds upon folds upon folds so that we can increase surface area to the maximum possible so that you have more space so that you can do that chemical digestion and that absorption. The first of those folds used to be called plicae circularis. Now they're just called circular folds. What I want you to notice is it kind of looks like there's speed bumps all the way through the small intestine. That helps to slow the food down so you have more time so that you can process the nutrients that are in there. Then, if you look at the circular folds, there are these extensions that reach up in there, and those extensions are called villi. And so I like to call them little finger-like things. And so, like, there's a villus, there's a villus. Those are helping to increase the surface area. So again, now you have more space. So you have more time because you slowed it down. You have more space because you have folds. If you look at the anatomy inside a villus, we're going to have a capillary bed so that we can absorb nutrients, and then we're going to have a lacteal. We had defined these back in the lymph system, but they're coming back to us now. What I want you to notice in the picture is that the lacteal has a bigger diameter, a bigger circumference than the capillaries do. That's going to be relevant as we start to talk about how different nutrients gets absorbed. So there's your basic anatomy of what's going on inside of a villus. Now, if we blow up the cells that make up the mucosa of a villus, even the cells have folds in their plasma membrane. Those folds are called microvilli. We talked about those the first time back in AMP1, back in the cell chapter. They are there to increase surface area again. So the cells have folds. We create folds in the wall, and then those folds create the circular folds, which are even more folds. So again, folds on folds on folds. Everything to increase surface area so you have more space and you have more time. In between the cells that have the microvilli, we are also going to have goblet cells so that we can secrete mucus. The absorptive cells are the cells that have the microvilli. They're all these pink cells, and they do exactly what the name says. They're principally there to help you absorb your nutrients. Down in the submucosa, you have duodenal glands. Those are going to secrete even more mucus. There is a pH flip that happens in the small intestine. So remember that the stomach was super acidic. Well, the mucus, and then we're going to also secrete bicarbonate ions into the small intestine. Those help to flip it around so that our pH ends up being more close to 8. We end up being basic or alkaline within the small intestine because of the action of the duodenal glands and the pancreas. Intestinal juice is the secretion of those things that we were just talking about. It's a lot of water, and then it's that alkaline mucus from just a second ago. Digestive functions of the liver. Primarily, it's going to be producing bile salts. We're going to talk about what emulsification means a little bit later on, but it does also, like, the very first place that nutrients go once we absorb them into the bloodstream in the small intestine is to the liver through the hepatic portal vein. So the liver does a lot of processing, and if you have an excess of nutrients, it can store a lot of those nutrients too. So it has other functions, but the question I'd ask you, what are the digestive functions? And so these are the big ones. Hepatocytes are just liver cells. Hepatic macrophages we had defined earlier. I've always loved the liver under a microscope. It's like an OCD person's dream. It's just hexagon upon hexagon. They're all arranged and they're super lovely. So this is where we have the hepatocytes and we have the hepatic macrophages that are circulating through there. We have a lot of lymph vessels. We've got a lot of blood vessels. The liver is a very vascular structure. Remember that the blood vessels, and especially the capillaries that go through here, are sinusoidal. They are the leakiest of the capillaries that we have, which is another reason why we also have all of these lymph vessels, is to pick up that extra fluid. Now, in addition to that, we also have a lot of bile that is being produced by the hepatocytes. That bile is going to accumulate in what it's calling the canaliculi, and the canaliculi are going to merge together to make larger bile vessels off over here. And so that's how the bile is going to eventually get to ducts that are going to take it to the gallbladder later on. All right, functions for the hepatocytes. So they process nutrients. We've talked about some of these a little bit before when we were talking about how insulin and glucagon work. We're going to talk about them again a little bit later on. We store a lot of our fat-soluble vitamins. So vitamins are classified as either water-soluble or fat-soluble. The fat-soluble vitamins are A, D, E, and K, and so we store a lot of those here. Weird factoid for you guys for the day. Polar bears have so much vitamin A stored in their liver that if you were to eat one, you could actually die because of vitamin A overdose. And so that's because they store a lot of vitamin A in their liver. It does detoxify harmful molecules. I mentioned alcohol in here, but a lot of drugs also get processed that way. Can also make bile salts. Now, this is actually a super weird story. So there is a condition that's called ectopic pregnancy. It happens because our ovaries and our fallopian tubes are not actually connected together, and so it's possible for sperm to reach egg outside of the reproductive system. Ordinarily, ectopic pregnancies don't. Essentially, we end up having to force abortion, and that's because the baby's not going to live to term. It can cause overwhelming infection or bleeding in mom, and so it ends up having to be a terminated pregnancy. There have, however, been cases. They're super weird, they're super rare cases. In this one, the baby implanted into the liver. Because the liver is such a vascular organ, it actually helps to provide a functional blood supply to the baby. The baby survived through the whole gestation process, but of course could not be born naturally, and the risk to mom was still super high. Where the uterus is designed to tear off an inner layer, the liver is not, and so mom has a very high likelihood of bleeding to death. If they had caught this earlier, they should have terminated the pregnancy, but she didn't realize she was pregnant because it was on the liver. It was not like she would have had a ton of symptoms aside from clearly her abdomen would have grown. But this is just, the liver is the only other organ that can do that, support a baby, and it's because it's so very vascular. All right. Hepatitis is inflammation of the liver. There's lots of reasons why that can happen. What we're going to be talking about are viral infections that can cause hepatitis. These are the three most common forms of hepatitis. So let's talk about what some of these words mean. Enteric means that you ingest the virus. Usually it's on dirty food or it's in dirty water. There is, pardon me, my favorite mode of transmission when it comes to any sort of a pathogen is what's known as a fecal-oral route of transmission, and this is one of those. So essentially what happens is the person has hepatitis, they're shedding the virus in their stool. When they wipe their butt, they get some of the virus on their fingers, and then they don't wash their hands. They go and they cook somebody's food, and the virus gets on that food, and then the other person gets hepatitis A from the person who didn't wash their hands after going to the bathroom. In some states, it is required by law that people who handle food get vaccinated for Hep A. Texas is not one of those states. If you do travel to countries where they don't have the sanitation that the United States have, it's recommended that you get a vaccine for that. It's a 2-dose vaccine. But here's the other thing, self-limiting. It means it's acute. You're going to get it, it's going to suck, but then it's going to go away. Okay. The next two work pretty much similarly. They are bloodborne. You can get them by having sex with an infected person, by sharing needles. There have been cases where people got it through blood transfusion and things like that. These are both chronic infections, unlike self-limiting. That means once you have them, you either have them until you die or you have them for the rest of your life. The problem with both of these is, since there aren't, well, there is now a treatment for Hep C, but since there's not a good treatment for Hep B, what's going to happen is the hepatitis is going to end up damaging the liver. Eventually you're going to get to cirrhosis, which means you have irreversible liver damage. You also have a dramatically higher risk of developing liver cancer. The only treatment at that point is a liver transplant. There is a vaccine for that. Most of you are young enough that you had the vaccine right after birth. That's a 3-dose shot where you get the first one right at birth, and then you come back a little bit later, and then you come back a little bit later for the third one. Hep C, there is not a vaccine for that currently. There is a cure, but I went ahead and threw this in here. It's one of the most expensive cures that's out there, and I don't know a lot of people who can actually afford that. Insurance does knock that down, but even with insurance, it's a very expensive treatment for that. These are not super duper common. We're not even really sure if Hep F is a viral infection because, like I said here, it's never been isolated from a patient sample and then grown in pure culture. So I just put a question mark because we're not sure what's up with that. The rest of that you can just get from here, but you don't see these all that often in the United States. Alright, after that I gave you this picture. This picture is showing you the arrangement of the liver, the gallbladder, the pancreas, and then the duodenum, that first foot of the small intestine. The liver has a bile duct that is going to take the bile from the gallbladder and then release it through this little ampulla and sphincter right here. The pancreas has a duct that merges into that same ampulla. So both the liver and the pancreas release their products through the same hole into the duodenum. Now the liver and the gallbladder are releasing the bile that got produced. The pancreas is releasing enzymes that help you digest, again, every major category of nutrients into the duodenum. And so even though it's a tiny little hole, this hole releases chemicals that really help you with the digestion of your food. We had talked about cystic fibrosis in a previous chapter. One of the problems with cystic fibrosis is that really thick mucus we talked about. That mucus can plug that hole, and then what happens is they end up digesting their own pancreas because the pancreatic enzymes that were supposed to get released into the duodenum can't because of the blockage, and so you end up kind of eating your own pancreas, which is a super painful, very bad condition that happens. But that is because of that same mucus we talked about back in the respiratory system. Cirrhosis I mentioned earlier. This is an end-stage disease. There is no treatment aside from a full-on liver transplant. Risk factors, we already mentioned the hepatitis earlier, but alcoholism can also lead to that. If you are an alcoholic who develops cirrhosis, it's an important thing to know that you will not be put on an organ transplant list. However, a family member can donate a portion of their liver to you. You can do a directed transplant. But because you couldn't take care of your original liver, they're not going to give you somebody else's new liver unless you have proven that you are in recovery and you're not drinking anymore. Alright, so earlier I mentioned the word emulsification. Here's what you need to remember. Fats do not dissolve into water. That means all of the enzymes that would be mixed in with your digestive fluids, either your gastric juice in the stomach or your intestinal juice in the intestines, it wouldn't be able to act on the lipids because the lipids would be floating on the surface where the enzymes are down in the fluid. So what we have to do is we have to take little droplets of the fats and then wrap them up by bile, which is kind of like a phospholipid. It's got a charged end and it has a nonpolar end, so it can take fat and then pull it into the water. That's what emulsification means. It's breaking down that droplet so that the lipid droplets can mix in with the water so that we can start the process of chemical digestion. This is not chemical digestion. This is emulsification. It's a different process. We're not changing the chemistry of anything. We're just taking droplets off of a larger mass of lipids. So this picture shows pretty well what emulsification is. Function of the gallbladder, it stores the bile, and then when you eat a really high-fat meal, like one of my favorite things in the world is cheesecake. After you eat a cheesecake, your gallbladder is going to release a lot of bile to help you emulsify all the fat that was in that cheesecake. So you can live without a gallbladder because your liver will still make bile. It's just that you can't release a lot at one time. So after you've had your gallbladder removed, you have to really watch the amount of fat that you eat or horrible, uncomfortable things can happen to you. I might come back to that later on too. Gallstones are one of the reasons why the gallbladder will be removed. So bile salts are salts. Those salts can crystallize, especially when there's a lot of cholesterol that's available. These are big enough that they're not going to be able to make it through the duct or the sphincter that is going to lead into the duodenum eventually. And so it can cause this blockage that prevents you from releasing any of the fluid from the gallbladder. It is possible for them to break up the stones, but usually they just go in and they remove the whole gallbladder and tell you to watch what you eat from there. Now, this person, we're in that ampulla that I was talking about earlier, and they have a large but really pretty gallstone that is stuck in there. I'm going to take us out. Hopefully the video will still work so you can see it, because what they're going to do is cut open the ampulla so that they can release the stone to relieve the pressure in the gallbladder. Not going to play. Okay, it'll play down here in the little corner, I guess. Okay. So this is a cautery instrument. Essentially what it does is it gets really hot, it burns through the tissue so that it can do the slicing. That has two benefits. One, it closes off blood vessels after it cuts through something so that there's not a lot of bleeding. And two, it gets hot enough that it can tend to kill off bacteria. That is a load of pus that had built up behind the gallstone that had gotten stuck. This down here is the small intestine. So we're in the small intestine and we're trying to open that hole back up. Notice just how pretty that stone is. It almost looks like it has gold flakes in it, but that's all just cholesterol and bile salts. It's kind of weird to think of it as pretty, but I think it's pretty. I'm going to see if it's going to let me make this bigger. Well, at least it's going to play up here now. How about this? Will you let me do that? Ooh, yay. Alright, so stones popped out just there, and you can see a rush of fluid that came out of the bile duct that had been blocked. But if they pull back very well, there's a lot of fluid that's built up there, but you can see how large that stone was and why it would not have come out of that little opening. And so we were not in the gallbladder. I don't know if they removed this person's gallbladder afterwards, but they did at least remove that gallstone so that that opening would allow the bile to come back out from the liver, and so the pancreas could release its juices as well. All right. So how can all of that lead to jaundice? This goes back to stuff we have been talking about. So remember, whenever your red blood cells die, you have to deal with the hemoglobin. The hemoglobin has the iron part that has to be dealt with by adding it to a protein. Then we've got the rest of the heme group, which becomes bilirubin, and you can see that happening off over here. That bilirubin is a yellowish pigment, and if the duct gets blocked, you can't put the bilirubin into the small intestine, which is where it's supposed to go. So what happens is it starts to build up in the body, circulates everywhere, and so you end up looking yellowish because of that buildup of bilirubin. All right, chemicals produced by the pancreas. So this is not in the same order I have them in the notes, but I'll do them in the order in the notes. So the pancreas releases a lot of bicarbonate ions. Bicarb is a base, so that's going to increase the pH. Trypsin, that is a protein digesting enzyme. Our problem is, so we had a protein digesting enzyme in the stomach, but it only works in an acidic environment, and the small intestines aren't acidic. And so pepsin stops working when you make it to the small intestine, so we need a whole new enzyme to help us do the same thing, and that's what trypsin is for. Trypsin works better at this higher pH. Pancreatic amylase does the same thing salivary amylase does, but the salivary amylase that we produced up in the mouth, when it hit the stomach, you need to remember that enzymes are proteins. Pepsin is a protein digesting enzyme, so what that means is you digested your salivary amylase in the stomach, so now you need a new amylase so that you can continue digesting those carbohydrates. We make pancreatic lipase, so there was a little bit of salivary lipase, but it didn't work very well. We had to emulsify the fats first. Now that we've got the bile in there and it's been emulsified, we can actually get to work starting to digest the lipids, and so that's what that lipase is going to do. We also release nucleases. That's going to help us digest nucleic acids like DNA and RNA. While you don't get calories from nucleic acids, you do still need those building blocks so you can replicate your DNA and carry out transcription. Where do the liver and pancreas release their chemical products? Duodenum, we talked about that earlier. Which digestive functions are carried out in the large intestine? So we're still doing propulsion of things moving through there. We'll still do a tiny bit of absorption, but most of our nutrients got absorbed back in the small intestine, so we're really not doing a whole bunch of that anymore. Elimination does happen at the very end of the large intestine, and so we've got that going on. Now, this is not one of the 6 processes that were mentioned earlier, but it's very important for your health and well-being. There are a lot of bacteria that live in your large intestine that help you out in various ways. And so this is also a big important function of the large intestine, is it contains what used to be called your normal flora. It's now called the microbiota, but it's the bacteria that lives in your large intestine. What is feces? So it's cells that have sloughed off your GI tract. It's mucus that got produced through all of the system. It's dead and dying bacteria plus live bacteria that just got scraped off the walls. And then it's got a fair amount of water in it. While your large intestine will absorb water, if it absorbs too much water, you can end up constipated. If it doesn't absorb enough of that water, you end up with diarrhea. So the water content of your feces does change depending on, I'll say, the quality of your feces. What is appendicitis? Oh, I guess I wanted to talk about this next, so never mind. I'll come back to appendicitis. This is, like I'm saying up here, just an FYI. Once you hit the age of 50, you are supposed to start going in for colonoscopies. Colon cancer can grow in you unnoticed for a long time, and once you get symptoms, it's probably already spread to new places. So by going in for colonoscopies, they can catch your cancer earlier, and you have a better chance of survival if you go get your colonoscopies like you're supposed to. People always hear horror stories about colonoscopies, so stuff that I wanted to mention about them. Really the worst part of a colonoscopy, ask anybody who's done it, is actually the day before the colonoscopy, because you have to clean yourself out. There's different pills and fluids that you can take for that, but essentially you overdose on laxatives to the point where you live on the toilet the night before, and that is unpleasant. I understand how that's unpleasant. But if you're not cleaned out, you'll still have feces stuck to the wall, and that it can obscure a small tumor that has just started to grow. So they need you cleaned out to make sure that that doesn't happen. When you go in for the colonoscopy, they will usually give you like a Valium the day before so that you're nice and calm. Then they knock you out, so you don't even know what's happening while you're in there. They shove the camera up and they start looking around for diverticula. They look for polyps. They look for tumorous growths. If they don't find anything, they might stop at what's known as a sigmoidoscopy, where they just look at the sigmoid colon. But if they are finding polyps, they'll go ahead and do the whole colon and look at everything. Now, if they still find something like a polyp, they'll remove the polyp while they're doing the colonoscopy. If, however, you waited until you had symptoms, well, again, that polyp has way overgrown and it's become a tumor, and that tumor has probably spread to other places. So a polyp, you might end up with just a tiny little scar right here, but if you waited longer, they have to remove like a foot of your large intestine. Now, since they can't just attach that to that, remember mesentery is here, it's not like these are open-ended things, you're now pooping out of a hole in the wall of your abdomen into something called a colostomy bag. If you have never dealt with a colostomy bag, consider yourself lucky, because the poop in those bags, it's a texture and a smell that you can't imagine. It's a whole other thing. And so please, when you hit 50 or when your parents hit 50, encourage them and for yourself to go get your colonoscopy, because it's better to have them catch you early before you get to the point where you have to poop through your abdomen, or you die just because they couldn't treat you. All right, so appendicitis. We talked about it earlier, inflammation of the appendix. How is it treated? We just flat out remove the appendix. We'll also give you antibiotics, because if it ruptures, again, overwhelming infection. Benefits of the normal flora, which again, nowadays it's called the microbiota. But these are very, very, very important things. We have seen time and time again through various research experiments that you cannot live a good quality of life if you are quote-unquote sterile, if you don't have a good normal flora that's going on for you. Your immune system won't work right, and you'll tilt towards allergies. You can be vitamin deficient, especially with some of the B vitamins and vitamin K. Your bacteria make that for you, and so you lose out on those things when you don't have that normal flora. They can compete with pathogens so that the pathogens don't have a place to land in your intestines because all of your apartments are already full, so to speak. And so that's another way that it helps to keep you healthy. We have also seen that they play a huge role in your metabolism. In fact, there are some drugs that in some people don't work as well because they don't have a specific species of bacteria in their gut to help them metabolize the drugs that they're taking. Not only metabolic activity of drugs, but also just your metabolic rate in general. If you don't have a certain subset of bacteria, your metabolism slows down and you get more likely to develop obesity. One of the weird little factoids that relates to that, in human breast milk, we put an oligosaccharide in there naturally that babies actually can't digest. We literally put sugars in our breast milk designed just to feed the bacteria in our babies to help them get a good microbiota. And so this, it seems like it's an afterthought for a lot of people, but if this breaks down, you don't live very well. And so it's a very important thing inside of you. Now, diverticula, I mentioned them just a little bit ago. They are herniations in the mucosa. So what that means is the mucosa actually punches up into the submucosa and you end up with these pits in the wall of your large intestine. Bacteria can get in there and start to overgrow. That can lead to inflammation, which is where we get to diverticulitis that we're going to come to in the next slide. Also, food material and feces can get stuck in there. That can lead to infection as well. So if a person has diverticula, the condition that you would write in their chart is diverticulosis. Next, if the diverticula become inflamed, then you have diverticulitis. At this point, the person is usually going to have symptoms. Pain is one of those symptoms. We can start to rupture the mucosa, which can lead to overwhelming infection. And so usually we go in, we give antibiotics first to try to reduce that inflammation, and then surgery may or may not be required depending on how bad things are inside of there. Some of the factors that can cause diarrhea, you can get those from right there. One of the things that's important for you to understand is in America, diarrhea is kind of a nuisance. It's a pain in the butt, quite literally. But if diarrhea is prolonged, what happens is you're losing a bunch of water and electrolytes. Well, that can cause a drop in blood pressure and then kidney failure. And so diarrhea can literally kill you if it's not treated. Now here we have stuff like Imodium AD and we have Pepto-Bismol. But if you go to some of the more developed or developing countries, then that can be problematic because they don't have those treatment options. Cholera is one of the leading causes of death in lots of areas of the world, and cholera's main symptom is diarrhea. And so that can show you how bad diarrhea can get. It's not just pain, it can kill you if it's prolonged. Constipation, what are the risk factors? So I give those for you guys right there. What I kind of wanted to tell you is there's something called the Bristol stool chart. If you work in a nursing home or an extended care facility, you have to write down how often people have BMs, which is bowel movements. One of the other things that they may or may not ask you to write down is what type of stool is the person having, because it tells you whether or not they're constipated. You should not poop like a deer. If you do that, that increases your risk for hemorrhoids. If you are pooping like this, then you run into that problem of, again, you're losing blood volume, you're getting dehydrated, you might shut your kidneys down if that happens for any length of time. You are supposed to be somewhere up here between a 3 and a 4, essentially. So if you're not, think about how you can try to fix that. If you are leaning towards the type 1 or type 2, you need to add more fiber to your diet, and you may need to drink more fluids during the course of the day. If this is where you are, you might want to go talk to a doctor, if it's, especially if it's been prolonged, because you've got some problems there as well. All right, enzymes. So you've got the table. The table can be filled in helping by using this picture right here. So this is your carbohydrate digestion. Notice that salivary amylase and pancreatic amylase are right here, and it shows you what they're doing. So both of these enzymes break down starch, which is a huge polysaccharide, into smaller polysaccharides called oligosaccharides. You can also break some of them down to disaccharides, which they're giving you some examples of disaccharides right there. Salivary amylase was produced by the salivary glands. Pancreatic amylase is, of course, produced by the pancreas. Oops, skipped too fast. Okay, for protein digestion, we have pepsin and we have trypsin. Pepsin breaks proteins down, which, remember, proteins have to be twisted and folded and given a specific three-dimensional shape. What we do is we break the twists and folds and we make it just a chain of amino acids. So that's how pepsin works. Now, once we have a chain of amino acids, we can start to break that chain. So trypsin breaks large polypeptides down into small peptides, which are just 1 or 2 or 3 amino acids. Really, I shouldn't say 1. I should say more like 2 to 4 amino acids. That's how big it's going to be after trypsin gets its job done. Next up, for fats. The bile helps with emulsification. It's, of course, produced by the liver, stored by the gallbladder. Pancreatic lipase can work after we've emulsified it. The pancreas produces that, and what that does is it breaks the fats down into glycerol and then fatty acids. And so this is what we're going to be able to absorb, is the glycerol and fatty acids. Nucleic acids, again, are DNA and RNA. While they're not providing calories, they are providing us with nucleotides. Nucleases are produced by both the pancreas and some of the glands in the small intestine as well. Explain carbohydrate absorption. So in order for you to absorb a carbohydrate, you have to digest it all the way down to a monosaccharide like glucose or fructose or ribose. You can't absorb disaccharides or polysaccharides. They have to be broken down to this level to be small enough to absorb. Proteins have to be broken down to amino acids. You can't absorb peptides. You have to have them down all the way to amino acids for them to be absorbed. These molecules, monosaccharides and amino acids, are both small enough to be absorbed directly into the capillary beds within the villi. From there, we'll go to the liver. The liver can process those nutrients. Now, lipids. We digest those down all the way to glycerol and fatty acids, but these are still fairly large molecules that don't absorb super well in water, and so they get absorbed into the lacteals instead of into the capillary bed. Remember that lacteals are part of the lymph system, so we bypass the liver and then we get shunted into circulation right before the heart. Remember where your thoracic duct and your right lymphatic duct emptied in? That's where your fats get emptied back into circulation. Now, for vitamin absorption, I mentioned earlier there's water-soluble vitamins and there's lipid-soluble vitamins. They follow the same rules as those other nutrients. So your water-soluble vitamins are going to be absorbed into the capillaries and then taken to the liver. Do remember that B12 is special because it needs to have intrinsic factor in order for you to absorb it. Your lipid-soluble vitamins, though, are going to get absorbed with the fats into the lacteals. This picture shows you which vitamins are water-soluble and which ones are fat-soluble. So if you didn't know that from a nutrition course, you might go ahead and write that down too. Now, malabsorption means that you are not able to absorb the nutrients that you're eating correctly. There's several different reasons why that might happen. What I'm showing you in the picture is the old school gastric bypass surgery. In that surgery, everything that is pale here, they would cut out and then disconnect from the digestive system. So most of the stomach, the fundus, the body, the pyloric region, your duodenum, and then at least a foot or more of the jejunum also ends up getting removed. That means you're not releasing a lot of pepsin, so you're not digesting your proteins very well. And then remember what happened in the duodenum? Your pancreas and your liver release stuff to help you absorb it. We bypass that, which means you lose a lot of those enzymes. So not only can you not eat a big meal because you've lost the stomach and you don't have that storage room, you're not releasing the enzymes to help you break down your food. And so from the food that you eat, you're not going to get a lot of nutrients out of those. So this is a surgical case of malabsorption. Now, I'll call it natural, although it is a disease state. Celiac disease is another malabsorptive state where the person is allergic to gluten, which is something that you can find in wheat. What happens is whenever they consume gluten, it causes inflammation in the intestines, and the inflammation prevents them from absorbing the nutrients, and so they will very often lose weight because they can't absorb the nutrients from the food that they consume. So when you see foods that say they're gluten-free, it's for people who have celiac disease. It's not just a diet that somebody should be on just for their own amusement or to lose weight. It's for people who cannot eat gluten or they won't absorb the nutrients they're supposed to have. All right, so that's the digestive system. Make sure you complete the quiz in school.